Colon cancer is no longer just a disease of older adults. Rates are rising in people under 50, often with few early warning signs. But there is a critical window where subtle changes can be recognized and acted on. Understanding these early signals may help support earlier detection and more informed medical care. The earlier it's detected, the more treatment options may be available. A shift in risk patterns has become increasingly evident in recent years, as colorectal cancer is no longer limited to older adults. Over the past few decades, the number of cases in individuals under 55 has increased significantly, reflecting a shift that continues to raise concern among clinicians and researchers. According to data from the National Cancer Institute, colorectal cancer is now one of the leading causes of cancer-related death in people aged 20 to 49. This trend highlights the need for earlier awareness, particularly in younger populations. Initial symptoms are often subtle and may be overlooked, particularly in younger individuals who do not typically perceive themselves at risk. However, recognizing these early changes may support earlier evaluation and clinical decision-making over time. When the disease is detected at a localized stage, the 5-year survival rate has been reported to be approximately 91% in some datasets, although outcomes can vary based on individual factors. In contrast, this figure drops to around 13% once the cancer has spread to distant organs. From a clinical perspective, most colorectal cancers develop gradually, often beginning as benign polyps. These growths can be identified and removed during routine screening procedures such as colonoscopy, which may help identify and remove abnormal growths before further changes occur. Staying informed and seeking appropriate screening when recommended can support earlier detection and support long-term clinical management. Recognizing the early window for intervention is critical, as colorectal cancer is generally more manageable when detected at an early stage. Clinical outcomes differ significantly depending on the stage at which the disease is identified. Early stage detection is associated with substantially more favorable prognoses, whereas advanced disease often limits available treatment options. This difference underscores the importance of paying attention to subtle and persistent changes in the body. Early symptoms are not always dramatic, which can make them easy to overlook, especially in individuals who do not consider themselves at risk. Yet timely recognition may support earlier evaluation and clinical decision-making. From a clinical standpoint, colorectal cancer typically develops through a gradual progression involving early structural changes in the colon lining. One important advantage is that screening methods such as colonoscopy allow for both detection and immediate removal of these growths. By addressing polyps before they undergo malignant transformation, which may help address abnormal growths before further changes occur. Taking action during this early phase can support more timely and appropriate management and help preserve a wider range of treatment options over time for patients. Building on the importance of early intervention, the next step is paying close attention to changes in your body's normal patterns, particularly those related to digestion. One of the more clinically relevant warning signs involves a persistent shift in bowel habits. While occasional digestive discomfort is common, symptoms that continue for several weeks, including constipation, diarrhea, or more frequent loose stools, may warrant closer evaluation. The colon plays a central role in absorbing water and forming stool. When this process is disrupted, it can reflect underlying structural or functional changes. In some cases, a developing mass may irritate the intestinal lining, leading to increased fluid secretion and faster transit time, which can present as ongoing diarrhea. In other situations, a growth may partially obstruct the passage of stool, slowing movement through the colon and contributing to persistent constipation. Some individuals may also experience an alternating pattern between diarrhea and constipation. This fluctuation can occur when the bowel is intermittently affected by a narrowing or obstruction. Although these symptoms can have multiple causes, consistent changes in bowel habits should not be ignored. Seeking timely medical evaluation can help clarify the cause and support appropriate next steps in care. In addition to monitoring internal patterns, it is equally important to watch for visible signs that may indicate underlying changes, particularly the presence of blood in the stool. Medically referred to as hematochezia, this finding can be associated with a range of gastrointestinal conditions, including colorectal cancer, and should always be evaluated with care. In some cases, blood may appear as bright red streaks on toilet paper or in the bowl. However, it can also present in less obvious ways. Stool that appears dark, maroon, or black may suggest that blood has undergone partial digestion as it moves through the gastrointestinal tract. This color change occurs through interaction with digestive enzymes and acids over time. Although darker stools are often linked to bleeding from the upper gastrointestinal tract, they may also be associated with sources in the right side of the colon. At the same time, more common conditions such as hemorrhoids or diverticular disease can also lead to visible bleeding, which is why assumptions should be avoided without proper evaluation. Any unexplained blood in the stool should be considered a signal to seek medical assessment, allowing for timely investigation, appropriate management if needed, and follow-up care. While visible bleeding can be concerning, it is equally important to recognize less obvious indicators, particularly those related to changes in iron levels. One clinically significant marker is iron deficiency anemia. Unlike overt bleeding, certain colorectal tumors may cause slow, continuous blood loss that is not visible during routine observation. Over time, this subtle loss can reduce the body's iron stores. Iron is essential for producing hemoglobin, the protein responsible for carrying oxygen in red blood cells. When iron levels decline gradually, the body may struggle to maintain adequate red blood cell production, leading to anemia. This process can occur without clear external signs, making it more difficult to detect early. Although iron deficiency can result from dietary factors or other medical conditions, it may warrant further evaluation in specific groups. In adult men and in individuals without an obvious explanation, unexplained anemia is often investigated more closely to exclude potential gastrointestinal sources, including colorectal cancer. Symptoms, such as persistent fatigue, reduced exercise tolerance, or general weakness may develop as anemia progresses. Because these signs are nonspecific, routine blood testing can play an important role in identifying abnormalities. Recognizing this pattern early may support timely diagnosis and more appropriate clinical management over time. In addition to changes in iron levels, another important sign to monitor is an unexplained decline in body weight and energy. Unintentional weight loss can be a clinically relevant symptom that warrants further evaluation, particularly when it occurs without changes in diet or physical activity. In the context of colorectal cancer, several biological mechanisms may contribute to this process. A developing tumor may be associated with changes in digestive function, which in some cases can affect how nutrients are processed. As a result, the body may receive fewer essential nutrients despite maintaining regular eating habits. At the same time, cancer-related metabolic changes can alter how the body uses energy. Tumors may release signaling molecules, including cytokines, that influence metabolism and shift how nutrients are distributed. This can lead to increased energy expenditure and reduced availability of nutrients for normal tissues. Over time, these combined effects may result in gradual weight loss and a noticeable decrease in physical strength or stamina. Because these changes can develop subtly, they may not always be immediately recognized as concerning. If weight loss occurs without a clear explanation, it is important to seek medical assessment. Early evaluation can help determine the underlying cause and guide appropriate investigation and management when necessary. Beyond changes in energy and metabolism, it is also important to pay attention to persistent, localized sensations within the digestive tract. One symptom that may be clinically relevant is a feeling of incomplete bowel evacuation. This sensation, known medically as tenesmus, refers to the ongoing urge to pass stool even when the bowels are already empty. From a physiological perspective, this can occur when a structural change affects the lower portion of the colon or rectum. As a mass develops, it may exert pressure on the intestinal wall, creating signals that resemble the presence of stool. These signals are transmitted through the nervous system and interpreted by the brain as a need for further bowel movement. Because this sensation can resemble more common conditions, it is sometimes overlooked or attributed to functional disorders such as irritable bowel syndrome. However, when the urge persists over several weeks or becomes more frequent, it may warrant closer attention. Although not specific to a single condition, prolonged tenesmus can be associated with underlying abnormalities that require further evaluation. Being attentive to these subtle but persistent changes may support earlier investigation, allowing potential issues to be identified and managed before more advanced symptoms develop over time. Another symptom that may go unnoticed at first involves persistent bloating and increased gas production. While temporary bloating is common and often linked to dietary factors, symptoms that continue for several weeks may require closer evaluation and should not be routinely ignored. From a physiological standpoint, changes in bowel function can alter how gas is produced and cleared from the digestive tract. In some cases, a developing mass may partially narrow the colon, slowing the normal passage of intestinal contents. This can lead to a buildup of gas behind the affected area, resulting in visible abdominal distension and ongoing discomfort over time. Slower intestinal transit also allows gut bacteria more time to ferment undigested material. This extended fermentation process can increase gas production and contribute to a sense of pressure or fullness. In addition, disruptions in bowel movement patterns may influence the balance of the gut microbiome, which can further affect digestive stability and overall gut function. Because these symptoms are frequently associated with benign conditions, they are often dismissed or self-managed without further investigation. However, when bloating and gas become persistent, progressive, or occur without clear dietary triggers, they may signal an underlying change that warrants appropriate medical assessment. While recognizing symptoms is important, a more effective strategy focuses on addressing potential risks before they progress into cancer. Most colorectal cancers develop gradually rather than appearing suddenly. In many cases, they begin as small, benign polyps within the lining of the large intestine. Over time, some of these growths may undergo changes that can lead to malignancy. One key advantage in colorectal cancer prevention is the role of screening. Unlike many other cancers, certain screening methods allow for both detection and intervention during the same procedure. Colonoscopy, for example, enables a trained specialist to examine the entire colon using a flexible camera system designed to identify abnormal tissue. If a polyp is detected during the examination, it can often be removed immediately and sent for further analysis. This approach allows potentially precancerous lesions to be identified and managed at an earlier stage. Because of this capability, colonoscopy is widely considered a central component of preventive care strategies. Participating in recommended screening programs supports early identification of abnormalities and plays an important role in early detection and management of abnormal growth. Rather than waiting for symptoms to appear, this proactive approach focuses on early action to support long-term digestive health monitoring and overall well-being. An effective prevention strategy also depends on knowing when to begin appropriate screening based on individual risk. For those at average risk, current guidelines in the United States generally recommend starting colorectal cancer screening at age 45. This recommendation reflects the observed increase in cases among younger populations in recent years. However, screening timelines may need to be adjusted for individuals with additional risk factors. Conditions such as inflammatory bowel disease, including Crohn's disease or ulcerative colitis, are associated with a higher long-term risk and may require earlier or more frequent monitoring. A family history of colorectal cancer or advanced polyps can also influence the recommended starting age. In many cases, clinicians suggest beginning screening approximately 10 years before the age at which a close relative was diagnosed. For example, if a first-degree family member developed colorectal cancer at age 45, screening may be considered as early as age 35. This approach aims to account for inherited risk patterns. Several screening options are available, including colonoscopy and non-invasive stool-based tests. A healthcare provider can help determine the most appropriate method and interval based on individual circumstances, supporting a more personalized and effective approach to long-term prevention. These symptoms can have multiple causes, and proper medical evaluation is important to determine the underlying condition. Thank you for watching. This content is for educational purposes only. If this changed how you think about nutrition, don't forget to like and subscribe for more science-based insights.